pleasure to share with you what Rwanda is doing to control NCDs. Quickly, I will share with you the burden of NCDs in Rwanda, our progress towards SDGs 3.4, and what we are doing to reach by 2030 this objective. We have NCDs and injuries in country with huge burden, almost 59% of cases that we are getting in our health facilities. Only last year we had 34,000 new NCDs enrolled in our system, and since 2019 we had increase of dailies associated with NCDs, and it affects our productivity of our population. It's clear that we are facing a problem of late detection of NCDs. Like for blood pressure, we do have 40% of adults presenting for the first time with heart failure at level of class 3 up to class 4. We've noted that number of cardiovascular disease increased from 25,000 to 88 just from 2018 up to 2020. Although we did good in terms of reducing maternal and infant mortality, it's clear that we need to work on NCDs so that we reverse the trend of increasing NCDs that we are facing in the country. Detection rate, as I said, the detection coverage rate is low. Like for chronic respiratory disease, for asthma, we are with 7.5%. For diabetes, we are with 4 coverage detection rate, which is really low. We need to increase the screening and early detection of NCDs so that we can act on time. Recently, we noted that with COVID-19, NCDs are really a big problem by fragilizing people who are affected by COVID-19. We noted that 90% of 34 cases of death were with comorbidities made by NCDs. And if we got 34 cases of death, we can say that it's because early access to health facilities was with early detection facilitated the early treatment of people affected with COVID-19, and it kept our case fatality rate at 0.7%. So these are trends of COVID that we noted, and number of cases we had, and number of deaths. You can see that the majority of our patients were between 20 and 59 years. Few of them were beyond 65, and it's unfortunately among those beyond 55 years, it's where we noted a huge number of cases of death with comorbidities of NCDs. To reverse this issue, we are now working on NCD strategic plan. We had finalized our strategic plan for NCDs. We developed its action plan with its costs, and we are now in mobilization of resources, including domestic resources. Clearly, we need to address the issue of universal health coverage so that we can increase early detection of NCDs. When we observe what we spend for NCDs, it's clear that we are spending less compared to other diseases. 0.8 to 2% representing our health expenditure are for NCDs. And for prevention, we are also spending less compared to other diseases. We need to invest so that we can change this trend for addressing the rising of NCDs burden. There is a reason to think that we'll achieve this UHC for NCDs. One is political commitment to address NCDs. Our population is covered with community-based health insurance, which allow early access to health facilities. Number 3, it's low output pocket expenditure, which is at 9%, and we want to reduce it so that people can be able to reach health services and be treated on time. Primary health care at community level, also for increasing detection of this disease so that the population can be quickly transferred to the nearest health facility. Number 4, we need to redefine sustainable mechanism of community-based insurance to face the rising of costs related to NCD burden. This is just to show how our president and the rest of the leadership are involved in the fight against NCDs. You can see that His Excellency, the President of the Republic, was in the public during what we call Car-Free Day every 2 weeks a month. So the strategic plan is really focusing on community engagement, prevention and control of NCDs, quality of NCD diagnosis, and the quality of services at all levels, with the objective of reducing premature mortality by NCDs by 25% by 2025. This is the plan, how it's costed, 638 million for 5 years, with activities for raising community awareness, increase of knowledge, early detection. We need to invest in essential equipment so that we can improve detection. We need also to work on adopting clear policies to reduce NCDs. In terms of expectation, if we go for a comprehensive NCD management with prevention, detection, care, and treatment, we are expecting increase of years from 2021 up to 2025, and also increase of death averted, as you can see on this slide, for cardiovascular disease, diabetes, breast cancer, and others. And it has a cost in terms of, it has benefit in terms of economic gains, because any death averted in Rwanda, it comes with almost $400 up to $2,000 for any averted death. For conclusion, for prevention of NCDs, we want to invest in the control of risk factors, and for this we need to develop required policies and institution. We have Rwanda Food Drug Authority to make sure that safe foods are on the market, and we need to develop legal instruments to ensure that people comply with those regulations. Number two, we need to go for a comprehensive NCD case management by increasing early detection, treatment, and care. And we need also to invest with government resources and partners' resources to make sure that we can achieve this SDG 3.4. I thank you.